custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about how to turn lemons into lemonade. So we're talking about many people who have come in the last few days, and they're coming because their treatment isn't working. And that's the reason we encourage people to come. If your treatment's not working or not well tolerated, it may be time for a change. A man came in this past Thursday, 50-year-old man, no children, came with his beautiful girlfriend. He had chest pain. In 2013, he was found to have a left lung cancer. He was treated at one of the hospitals in the 5 boroughs. He then had chemoradiation elsewhere. He had 38 radiation treatments. No one talked about markers. When he had surgery at that hospital, they opened up his chest, but the cancer, and you could have seen this actually by CT scan or PET CT scan or MRI, the cancer was wrapped around the aorta and the major structures in the chest. So surgery wasn't going to be successful. And we've spoken about this in the last few weeks. He could have had a needle biopsy. You could have, if you want to know what this is exactly, and it turned out to be a non-small cell lung cancer, you could stick a needle in about 5 minutes, have an answer, compared to opening up his chest, all the convalescence and the pain and the cost and the hospital stay associated with thoracotomy, which is opening up the chest, versus needle biopsy. So sometimes people do the most invasive procedure when maybe if the patient knew that you could have a non-invasive or minimally invasive procedure to get to the same point, they would choose that. If it were me, knowing that you can't resect the cancer, then just get the biopsy with a little needle and don't open up the chest, don't make a mess, don't make pain. Well, guess what happened next? All that treatment didn't work. He had surgery, he had chemo, he had radiation, standard chemo, standard radiation in the 5 boroughs. Didn't work. Then he went to a big hospital, a big prestigious hospital in Manhattan, and the surgeon said, "Oh, I can take that out." Well, when the cancer is wrapped around the aorta and the major structures of the chest, or wherever it is, surgery usually is not successful. And like we spoke about before, the man with the tongue cancer, if they cut through cancer, like when you cut a loaf of bread, you're just spreading the crumbs, spreading the cancers. Well, so he had a big operation, a huge scar on his left chest. They were not able to get all the cancer out, of course, because you can't. It's up against the blood vessel, it's up against the nerves, it's up against the structures. Now, the cancer since that time has just been growing. He has pain in the chest. He has pain in the arm, probably because the cancer is wrapped around the nerves going to the arm. In April, he had a mass that was 9 millimeters in the right upper lobe, which is the opposite lung. By now, he came in this week, the mass in his chest is 10 centimeters. It's the size of a fist with pulmonary nodules. He came in to me and asked what I would do. Well, I would personally not do the same treatment that failed before. If treatment failed before, it's unlikely to work now with us, and we've treated many, many people, thousands of people with lung cancer with radiosurgery. Radiosurgery is our method, non-invasive. It's what we pioneered. We were first in the Western Hemisphere, first in America, and of course first in New York, and even first on our street with body non-invasive radiosurgery. I would talk about that to control the cancer, which most likely it will, 90% where we aim the beam for the rest of the life of the patient. Try to control this pain and suffering which he's having. Try to get the cancer finally under control, because all the treatment he's had, 2 big surgeries, standard chemo, standard radiation, nothing's really worked. We gave him all the options, gave him our information, examined him, and now he can choose standard therapy or something new, something innovative that has a good chance of controlling the cancer where we aim the beam. Another interesting patient, a gentleman who came 60 years old. He was diagnosed 6 years ago in 2008 with prostate cancer, Gleason 8, so high-risk cancer, and he chose to do nothing about it. He came in October last year to see me with a PSA of 11, Gleason 8. I told him he was at very high risk. High risk for prostate cancer is PSA over 10, Gleason more than 6. He had both that were high risk. He decided to go on megavitamins, alternative therapies, antioxidants, started to load up, and guess what? His PSA doubled. Okay, he had all the herbs, all the spices, all the alternative therapies, and his PSA doubled, which means his cancer doubled. Luckily, we got staging tests for him, bone scan and CAT scan. The cancer didn't travel. He still has a good chance. Of course, it would have been a better chance if we saw him and he agreed to treatment last year when we first met. But again, we can only give information. The President of the United States is the patient. You are the patient, and we work for you. So the patient has copies of all his tests, all his reports, and he's coming in tomorrow to start treatment. We wish him well. We're going to fight like heck to get him into remission, because that's what we want to do. We fight for each of our patients. And another lymphoma patient. We talked earlier about the woman with T-cell lymphoma. Well, this is a gentleman with lymphoma, non-Hodgkin's lymphoma, that has massive adenopathy, lymph nodes in his neck. Sometimes he's walking down the street, see people with a huge mass in the neck. Well, this might be that man. He's got a huge mass in the left neck and a mass in the right neck. The left is bigger. He's had this for quite some time. He's decided to proceed with focused beam radiation. So we're going to be treating him with stereotactic radiation, 5 treatments. It's non-invasive treatments, and according to our data, he has an excellent chance of getting into remission. And not only remission, but it's cosmetically sensitive, because it has huge mass. Wherever he goes, he feels awkward about it. People stare at him. He doesn't want that. He's also having trouble swallowing. He was in the hospital. He had aspirated a chicken bone. So the cancer is pinching on the nerves. It's causing pain, causing suffering, causing awkwardness. And we believe we can help him shrink down this cancer non-invasively in just 5 treatments. Each treatment takes about 15 minutes in our center, which is at 38th and Broadway. My name, by the way, is Dr. Lederman. Work at Radiosurgery in New York. We try to offer excellent treatment for every patient. We try to fight for the patients who want to be fought for. We are located so that you can easily get to us. If you take trains, buses, subways, we're at 38th and Broadway. We're close to Grand Central, Penn Station, Port Authority, PATH trains, and of course if you drive in, there's plenty of commercial parking in the neighborhood. We have something called Urgent Cancer Consultants, where we promise to see you within 1 business day, so you don't have to sit home and suffer. If you've got a lump, a mass, and don't know what it is, give us a call. If you're having cancer treatment that's not working or not tolerated, give us a call. Again, my name's Dr. Gil Lederman. Our next show is tonight at 9 p.m. on WOR. Thank you for listening. Have a great day. Enjoy this beautiful, lovely day. God bless you, and thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 12